Hello, everyone. So this session, Chewing the Facts, What's the Truth About the Obesity Crisis, is in association with Spiked. Department of Health says that 61.3% of adults and 30% of children are overweight or obese. Not only does this cost the NHS a bomb, it's also, we're told, storing up untold problems for the future. At the same time, the obesity time bomb ticks away. Other reports from the British Heart Foundation and the Department of Public Health at Oxford paint a slightly different picture. So there's apparently been an unprecedented reduction in deaths from cardiovascular disease in the UK. Life expectancy continues to rise for both men and women. And type 2 diabetes seems to be a problem only for certain ethnic groups. We've also got organisations like Oxfam and the International Red Cross increasingly worried about the enormous, what they're calling destitution, hardship and hunger facing people in the UK. And there are now 400 food banks tackling what's considered to be Britain's food poverty. So on the one hand, we're all dying and are unhealthy because we're too fat. On the other hand, we're all living longer and healthier lives than ever. On yet another hand, we're all starving. So it's quite a confusing picture, I think you'll agree. We have an hour to sort this out. So just to introduce our speakers, in the order in which they're going to speak, Jane Ogden on my left is Professor of Health Psychology at the University of Surrey, where she teaches medical, nutrition, dietitian and psychology students. Her main research areas are the control of eating behaviour, parenting and the medical and surgical management of obesity. Her new book, The Good Parenting Food Guide, is out early next year. Next to her is Henry Dimbleby. Henry started his working life as a commis chef, as did I. Oh. And then joined the Daily Telegraph. He then worked for a management consultancy firm where he met John Vincent and they founded the Leon restaurants chain together. He's co-author of the recent school food plan. Angelica Michaelis on my right is a senior lecturer at the Department of English at Manchester Met University. Her research focuses on the meaning of food and how our identity is intertwined with how we regulate what we eat. She's currently working on a monograph entitled Eating Theory, The Theory of Eating. Great title. Rob Lyons, next to me, is Associate Editor of Spiked and writes on science and risk. He's the author of Panic on a Plate, How Society Developed an Eating Disorder, and he blogs about food-related debates at paniconaplate.com. So, Jane, if you'd like to kick us off.
Okay, I'm a professor in health psychology, and it seems extremely clear to me that as a psychologist, the main cause of obesity is clearly psychological. Now, this doesn't mean that people who are obese have eating disorders or are depressed or anxious, although some of them do. It's because at its very basic, obesity is caused by eating more than the body needs and doing less than the body should be doing. And these two very simple behaviours, eating and exercise or activity, are related to a whole load of psychological factors. Our beliefs, our emotions, the learning that we've had from childhood, the habits we've developed, the peers that we surround ourselves with, the social world that we live in, and our parents. And all of these psychological factors then determine what we eat, how much we eat, and whether we do enough exercise or not. And just to give you a little example, anecdote though it is, I was sitting in Pizza Express a few months ago, having pizzas with my children, and on the table next to me was a woman with her little girl, about 3 years old. And I guess the trick is never to sit next to a psychologist when you're having lunch with your children because they stare at you and take notes. The mother and her little girl were having a wonderful time sharing a huge ice cream out of a big glass with a spoon each. And the mother said lots of things, including, "You have been a good girl today, you've eaten all your pizza, well done, isn't this lovely, this tastes wonderful, aren't you nice, and isn't this nice being out together?" She then said, "If you finish it, then you can go in the buggy and you don't have to walk into town." And this annoying psychologist sitting next to her, i.e. me, thought, in that 2-minute conversation that I was watching, that little girl had learnt that ice cream was a treat, that it was a fantastic way to bond with your mother or someone that you care about. It was emotionally charged because they were obviously having a lovely time together, and there's nothing wrong with that. And also she learnt that walking is boring and riding in the buggy is the way forward. And if you project that into the future, into that little girl's life, then it's not really surprising that when she's upset or fed up or needing a treat or wanting to emotionally bond with somebody, she will then turn to food, like ice cream. And when she's feeling tired or fed up, rather than walking, she'll get into the adult version of a buggy, i.e. the car. So to me, obesity is so clearly a psychological problem. And those out there who believe that it's genetic, my answer always is that although there's a bit of genetics involved in it, there's no way that obesity can be caused by genetics, because we know that as soon as one person moves from one country to another, their weight increases or decreases according to that country that they're living in, and their genes do not change. My students talk about the Heathrow stone. When they arrive in England from New Zealand or Australia or from Greece, they gain about a stone in weight. They call it the Heathrow stone. Now, their genes do not change when they pass through Heathrow. And secondly, obesity cannot be an addiction to sugar, which we've been hearing about recently in the press, because people do not eat sugar. Nobody opens a cupboard, gets the sugar out and eats it. They eat the psychological, social version of sugar known as cake, or, depending on where you live, deep-fried Mars bars. So it's not genetic, it's not about neurochemical addiction, it's about psychology. So if psychology is really important in the cause of obesity, then what about the solutions? Are they also psychological? Well, there's two factors that we have to address. One is the treatment of obesity, and the second is the prevention of obesity. In terms of the treatment of obesity, for those who are already obese, ideally, we would also treat their psychology. We would change their beliefs and their behaviours, and we would change their habits, and we'd deal with their emotions. But what we know from the evidence is that this is extremely hard to do. It is very hard to change the kind of habits that have been entrenched since childhood. So in terms of treating obesity, what we need to do is target the individual a bit, but also we need to target society. At the moment, we live in a world where it's very, very easy to become fat, to overeat and to under-exercise. And we need to change the way that society is structured. We need to tackle the food industry. We need to tackle their advertising. We need to get in touch with town planners and make sure that we have pavements and street lighting so that people can be more mobile. And at the end of the day, we probably do need to use surgery to treat those people who are very overweight, because trying to change their beliefs and their behaviour is so very difficult. Then, in terms of prevention, what do we do? For our society, prevention has to be the main focus. It's difficult being obese in the here and now, but there are generations upon generations of people who are destined to be obese in the future. So we need to tackle the prevention of obesity now for the sake of those future generations. And again, how do we do this? Well, first and foremost, we have to change society. We have to make it easier to be healthy, easier to eat well, and harder to overeat and to be inactive. But for those future generations, we also have a chance to change their psychology. It's not too late to tackle people's beliefs and behaviours and their habits and their emotions before they've become entrenched. And so I guess there are two ways to do this. First of all, we must not become a society who normalises obesity. We mustn't give in to the obesity epidemic and accept it as being okay or inevitable. Because once the people become more obese, then the future generations will become even more obese. And there's a very obvious domino effect that happens with obesity. The best predictor of how fat we are is actually the fatness of the people around us, or the fatness of our friends and our peer groups. So if we give in to it and we accept it and we see it as being inevitable, then the future generations don't stand a chance, because it'll simply cascade from one generation into the next. But secondly, we have to change the psychology of the future generations by tackling schools, which I've just realised I've written an article about this person on my left here, though I never met him before. We have to tackle schools and school dinners, and we have to use teachers as good role models, and we have to manage the way that children eat in schools. We have to tackle parents, and I know that parents are always being blamed for everything, and I am a parent, and I therefore will be blamed myself. But we have to tackle parents to be good role models, to speak properly to their children about food and activity, and to manage their own microenvironments by changing what they bring into the house. We have to tackle the TV and the media and we have to tackle social media to make sure that it's easy for children now to develop healthy attitudes towards foods so that in the future they don't overeat and under-exercise. So I guess my argument is that obesity is clearly a psychological problem, and it's clearly caused by psychological factors. But it doesn't mean to say that solutions have to be at the level of the individual or psychological. I think in terms of treatment, we need social change, and I think in terms of prevention, then we can target individuals for individual change. But until society changes, it's very, very difficult to eat and behave in a way that means that you won't actually fulfil the inevitability of becoming an obese person.
Thank you, Jane. Henry, I bet you don't sell deep-fried Mars bars, do you?
I don't, no. Our species is in rude health. We are stronger, taller, better looking than we've ever been. As you intimated in your introduction, life expectancy, global life expectancy, is 69 years. That was in 1900, it was 31. So we are living an incredibly long time. We're very healthy. And actually, if you look at the quality of life as well, as it's extended, I was sitting with a doctor who's doing some research on this, and he was saying one of the odd things about the extension of life is the really bad bit, the really horrible, painful, miserable bit of life is still about 7 years, which is what it was in 1900. So not only are we living long, we're actually living long, apparently, with a decent quality of life. The evidence is also confused. We all know, and I don't think there'd be anyone on this panel who would say that obesity as defined by BMI was the best measure of long-term health. You can be heavy without being fat. You can be fat without being unfit. Look at the England rugby team. Everyone says, every one of them obese. It's also not an epidemic. You can't catch fatness from the man standing next to you at the bus stop. And there's, as far as I know anyway, and there's quite a lot of evidence that it's slowing down, not accelerating, particularly in the States and in the UK. Also, the debate itself causes problems. So there is a stigma, and I've been to a lot of schools in the last year, probably 30 schools. There is a stigma about being fat, which is reinforced by a lot of messages in schools about not wanting to be fat. That could cause problems with body image, anorexia. The food industry responds by selling us things to solve it, as if kind of food which caused the problem could in some way solve the problem. And there's good debate. A number of people believe that the whole growth in the low-fat products was actually one of the causes or the accelerating factors of obesity, because fat was taken out and replaced with sugar and all sorts of other junk. So shouldn't we just stop the debate? Shouldn't we just say, look, let's let people eat what they want? It's not worth talking about. We're healthy, and talking about it makes people miserable. And the answer is no, but we do need to be cleverer about how we deal with the problem. So why is the answer no? Well, first of all, there is the cost. It is incredibly expensive. Food-related diseases, not just obesity, but food-related diseases cost the NHS about £5.8 billion a year. And as I said, that's not just obesity. So, for example, type 2 diabetes, increasingly people with normal weight are presenting with type 2 diabetes. It would include those people as well. There's an argument that's made about that cost that actually, if you treat these people, they'll go on, and there are things called good illnesses and bad illnesses. Basically, if you treat someone and they go on to live a longer life and cost more in the lifetime, there's an argument that's made occasionally that actually it's better for them just to get fat and die because they'll be cheaper. They'll be cheaper for you in the long term. But it's quite, looking into that's quite flimsy for obesity. But also, you could spend that money. Basically, the fact we're spending 5.8 billion on people with food-related diseases literally means other people aren't getting drugs that they could have. There is a trade-off being made, and that money could be spent elsewhere. But the second reason that it is important is the quality of life. And I think that stat about the 7 years is misleading in terms of what happens to someone who goes down that path of becoming obese. As I said, I've been to about 30 primary schools in the last year. 10% of children are obese when they arrive at primary school in reception, age 4. I don't know if anyone has children here. It's almost impossible to get a child of 4 fat. And yet 10% of people arrive at school obese. And when you look at them, particularly for children, and you watch their behaviours in school, and you see them unable to participate in the games that other children are playing in, unable to jump on the trampoline, you hear their parents talking about how they shouldn't do this and they shouldn't do that because they probably can't cope with it. And then by the time they leave primary school at 11, for each of those children who arrived at primary school obese, there are 2 children leaving primary school obese. And by the way, obesity in a child, it is very hard to have the kind of macho Lawrence Dallaglio style physique that means that BMI doesn't work at a primary school. If you look at primary school children who have a BMI of over 30, they are really uncomfortably fat. It's an unpleasant stage to be in. So, and they will then, and the evidence shows that they will go on, being fat is a good indicator of lifelong obesity. I don't know if anyone here has ever been to a type 2 diabetes clinic. They're pretty depressing, miserable places. So the expense and the quality of life means we do need, as a society, to do something about this. But what do we do? No amount of posters on bus stops is going to change our behaviour as adults. Very, very difficult to change adult behaviour. But we can change the behaviour of... Oh, sum up! But we can change the behaviour of children in schools. So if you introduce food to children in a non-medical way, if you teach children that cooking is one of the great creative outlets of human creativity, if you have teachers eating with the children in the school, eating good food, you can create a culture, a normalised food culture, that makes it not something to be feared or something that's dangerous or something that's going to make you fat, but just something that is critical to the enjoyment and health in life. And I'm delighted that that's already started. I'm delighted that the government, as part of the work we've done, have done a number of things, such as introducing cookery for every child under 14 as compulsory, and giving free school meals to all children in the first 3 years of primary, meaning that everyone eats together. So it is a beginning. School is the place to do it. And do, by the way, go to your school of your child and check that the food is good and that the atmosphere is good. And if it isn't, give them a copy of the plan. They can do something about it. Self-help guide, www.schoolfoodplan.com. Summed up. Thank you.
Thank you, Henry. Angelica.
Thank you very much for these 2 contributions, which I think was are very interesting. And whilst I agree with most of what has been said, there's something that kind of bothers me, and that is that we know, Jane, what you said, there are reasons, you give us reasons why people overeat, and, the psychological ones, and also kind of physiological ones, the calorie intake, and if we change the calorie intake and the way we move, then, it's actually a quite easy equation. And also what you said, let's start at school, and I absolutely agree with it, but why doesn't it work? And that's the thing that bothers me, and that's why I would like to start from a slightly different point of view. And I want to start with a quotation. This is from the Medical Sciences Bulletin from the 1990s. I can give you the correct bibliographical source. The pharmaceutical industry is finally waking up to the fact that obesity is a chronic medical condition that requires lifelong, and that's in italics, treatment, preferably with a pill, and that the market for such a pill is enormous. Now that I find chilling, because what that tells us is that there is actually, in the same way as there's economic detriment in relation to obesity in an obese society, there's also something of an economic gain to be made with fatness. And therefore, I would say fat is, in more than one sense, a four-letter word. It's a four-letter word because, in a way, it alerts us to something that is not to be resolved easily. It cannot be resolved easily. Whereas, you can be addicted to cigarettes, you can be addicted to alcohol. You give up cigarettes, you give up alcohol, as hard as it might be, but we cannot give up eating. So one of the things we have to learn, and I think this is what Jane said and what I think is really interesting, is a way of how we relate to food and actually to find out what does food mean to us, because food is not just nutrition. It isn't nutrition, it stands for something else. And as long as we do not invest as a society in helping people to find out why they eat and why they sometimes try to seek rescue in fatness, because fatness can also be a safety. It can make people safe, it can be a barrier to dealing with issues in the world. And it's not just purely psychological reasons, but it's the whole way how economical, social, historical, and psychological and physiological reasons all come together. So what is interesting is, for example, that while we nowadays would not make jokes about race, gender, sexuality, gay people, or you make it, but, as the coach of the English team has, it gets very difficult. There are still jokes about fat people. We still make jokes about them. We still think they are really funny. There is still the idea of the fat man in a television program. And one of the reasons, I think, why we still do this is because we think that fat is something which we have control over. We can control. It is preventable. So in a way, when we laugh at these people, when we ridicule these people, then we don't think we make fun of a condition, but what we make fun of and what we criticize with this laughter as well is that these people are weak, they are lazy, and we are actually scared to become like them because it's very easy to become fat. And I think part of our way we deal with obesity, and I would like to call it fatness, because obesity is already a slightly purged term because we use the medical term. But if I use the word fat, people are fat or you are fat, that is something that is very uncomfortable. And I think that fat people and fatness in our society represents something very uncomfortable. And when we look at fat people, they make us feel uncomfortable. They make us feel uncomfortable because it shows how easy we can transgress. They make us angry because we think, who do you think you are to take up so much space in our society where we have less and less space? Yeah, you sit in the bus, you with your fat body. So there's a lot of anxiety. There's a lot of anxiety here, but it is true. And I think it says the way we care about fatness is, on the one hand, as Jane said, it is a question of physiological reasons, medical reasons, but I think we should take a hard look at ourselves and ask ourselves, why does it make us so anxious to be surrounded by fat people? Thank you very much.
Thank you, Angelica. Rob.
Well, as apparently the only fat person in this room,
Makes me feel very anxious.
where's this 25% of the population? Where are the rest of the fatties? I'm here representing I'm here representing the Fat Liberation Front. There aren't a lot of marches with the FLF, I have to say. Quite a lot of fundraising dinners, which is nice. Anyway, moving on, as we do. I actually would chime with quite a lot of what Henry was saying. I'm going to rip through a few points about obesity. First of all, there's this claim, it's often made, it's got the official backing of the World Health Organization and so on, that obesity is a disease. And I don't think that's true at all. I think it's associated with some chronic diseases like heart disease and type 2 diabetes in particular. But I think it's unhelpful to describe it as a disease in and of itself. If we were going to classify body shapes that have an association with premature death as diseases, then being tall is, it should be regarded as a disease. If we want to, treat people who have a biological affliction that causes a premature death, then men should all have their testicles cut off. It's simple as that. There's a very strong association between having testicles and dying early. So we should do something about it. Or we could just realise that the vast majority of people who are described as obese are not in any meaningful sense sick. And as Henry rightly says, and as a disease, if it's not a disease, it's not contagious either. I can't give Jason my obesity. Nor is there an obesity time bomb. So we're frequently told that what's going to happen with obesity rates is they're just going to carry on going on up and up and up until eventually we're all obese. By 2050 or something, 90% of us will be obese. And there's absolutely no sign of that happening at all. Obesity rates in the UK have plateaued just around about 24-25%. They've been there around that kind of figure for about a decade. And that's actually reflected across the globe, that places where people have got fat in the 80s and 90s, developed countries, that rise in obesity rates has slowed down. For children under 16 in the UK, actually, if anything, obesity rates are going down. I mean, it's always a bit too early to tell, but they seem to have peaked in about 2004 and gone down a bit since then. Fourthly, obesity is not the same as morbid obesity. So most people who meet the definition of obesity, this body mass index over 30, are merely chubby. So I'll reveal, but my body mass index is about 32. So I'm well into the range of obesity. A small proportion of the UK population is morbidly obese. That's having a BMI of over 40. Just 2 or 3% of these people. Yet whenever they talk about obesity on TV, you will see they'll say 25% of the population is obese. Then they will cut to a picture of somebody with their face chopped off or their face pixelated who is morbidly obese, when they only actually reflect about 2 or 3% of the population. Even America, which is apparently the epicenter of the obesity epidemic, only about 5 or 6% of people are morbidly obese. And again, that's the overall obesity statistics in America, even there, have plateaued as well. Type 2 diabetes is regularly discussed as a problem that's going to arise from that. But as Henry alluded to, in fact, it's not simply an obesity disease. People who are obese seem to have a greater likelihood of getting type 2 diabetes. But in reality, about the same number of people have got type 2 diabetes in this country who are not obese as those who are obese. You're more likely to get it if you're obese, but there's far fewer of you. And the other thing about obesity is trying to treat it in the same way as other kind of public health problems that we've had in the past, like smoking, isn't very useful. With obesity, actually, the diseases that are related to obesity are relatively treatable. And our treatment of, for example, type 2 diabetes is getting better all the time. Lung cancer, on the other hand, and we talk about smoking, lung cancer kills about 1/6 of smokers. 95% of people who get lung cancer die. So it's quite a different kind of kettle of fish in terms of how worried we should be about it. Equally, while there's reasonably good treatments for obesity-related diseases and they're getting better, there's actually no good treatment, I don't think, for obesity. So the advice in general is eat less, move more, and you will lose weight. And that does work temporarily, but most people who do that, who go on a diet, will put the weight back on over the course of 2 or 3 years or however long. And in the process, probably depress themselves greatly about their inability to solve this problem. So I think that the obesity problem is overstated. It's not something that we should worry about in the way that it's been presented. But I think the obesity epidemic is alive and well. And that's because I don't think it has very much to do with overweight people or health. I think in reality, it's the main way in which the medical profession, health campaigners, and politicians can persuade us to open up our lives to their intervention. Even if you don't think that your weight is a problem, think of the children. And I think that that's a real serious problem. it really strikes me that when I read the work of obesity crusaders about these things, you very quickly start to read a completely different message that's going on underneath it. Whether it is, especially people who start to go on about the obesogenic environment that will be, it's not our fault that we're fat, it's all these mega corporations, it's the design of cities and whatever. I think that actually that is a thinly veiled political agenda going on there that is, against big corporations, against people who are vaguely neoliberal. And I think that that's not a particularly helpful. It's just as bad in its own way as the idea that obesity is a kind of moral weakness and we all need to kind of take responsibility for that. So I think we should just chill out about it. There's a small proportion of society who have a genuine problem with obesity. It really gets in the way of their quality of life. But otherwise, the rest of us really should just stop and enjoy our food.
Thank you, Rob. We don't have long, so I want to come straight out to you, but you don't have to agree that it's a psychological or sociological problem. You can argue it's genetic if you like, but we'd like to hear from you anyway. So a lady right at the back.
Jane's introduction was, for me, a good example of why psychologists should play no role at all in social policy and have nothing to say about public life. It's incredible. I know it was an anecdote, but you've basically extrapolated the entire lifespan of this 3-year-old based on the fact she had an ice cream with her mum in Pizza Express. And that strikes me as a perfect example of what's wrong with this discussion, which is we talk about, particularly with children, in a very deterministic way about the diet they have. The idea that the 3-year-old eating ice cream has her life mapped out for her is absolute nonsense. It's just ridiculous. And it's a really, really backward way to understand food and also what people are about. So I'm sorry, Jane, but I really hope you have no role at all in determining anything to do with public policy. It's really, really terrifying. This 3-year-old, who knows what she may turn out to do and be. I will bet my life on it that ice cream is going to have absolutely no negative impact on her whatsoever.
With regard to the point about food in schools, I understand that it's really important to introduce children to healthy eating and things like that, but I find that's way too easy to go incredibly wrong. I'm in a 6th form and it's attached to a secondary school, and you go into the year 8 classrooms, there's 12-year-old girls doing class diets. One of them will go to the vending machine, buy a chocolate bar, she'll come back into her classroom, and the girls will say, no, you can't eat that, we're trying to lose 5 pounds. And that's disordered eating in itself. And I think now that the mainstream sort of recognises anorexia as a real problem, things like thinspiration are dying down, and we've seen the rise of things like fitspiration, which is where you'll see girls on things like Twitter, Tumblr, and they just feel like absolute crap if they didn't go to the gym. They're stressing out about whether something fits their macros or something like that. And I also believe that's something to do with fat, rather than being just a physical description, is a really negative term. Apparently it makes people anxious and you're lazy and you can't come up to this room. And I just wonder, is it really that big of a deal? Do we want people to be living long, thin, miserable lives? Or can they have a maybe marginally shorter life with really nice chocolate cake? That's my question.
I wanted to talk about, the figures, Rob, that you gave about the US, because I live in Brooklyn, New York, where we are, on average, about 5 pounds heavier than people that live in Manhattan. Although, incidentally, it's more unhealthy to be underweight than overweight, but that's not what I want to talk about. And I think it's very interesting that over his 12 to 13 years span, our Mayor Bloomberg, has made it almost his central mission to police what we eat under the guise of the fact that we're all overweight, and obesity is a problem. And, it's a drain on resources. But it's interesting when you look at the way that he does that. So, for example, he had this big campaign against trans fats, and you may or may not know, you're more likely to eat trans fats before they were banned in a diner where you can eat relatively cheaply than if you go to a restaurant on the Upper East Side. People don't like the idea of people eating burgers in McDonald's, because evidently they're less healthy than the burgers that you might eat on the Upper West Side. The recent soda ban that the mayor tried to ban large bottles of soda, under the guise that you buy a large bottle of soda, you're gonna drink the whole bottle, and then you're gonna get fat. But there was no ban on large bottles of wine, because presumably if you drink large bottles of wine, you either don't get fat or you've got some sort of, control. And I think that given the fact that the statistics contradict what people are saying about obesity, I think what's really going on here is the policing of our behaviour and the policing of the private sphere. Because it used to be your own private business, what you ate in your own home, and if you eat out, then still, what you eat out, what you take in your lunchbox, as a child for your lunch. Whereas now it's increasingly the case that all of these things that used to be, just a question that was taken for the private individual are now becoming part of something that the authorities feel that they should police. And there's this underlying assumption that ordinary people are so stupid and so weak-willed and so ignorant that they don't realise that Diet Coke has got less calories than regular Coke, etc., etc., etc. And I think that's the danger. That's the danger in this discussion.
A few points I'd like to make. I think we're in danger of trivialising the situation here. I think some of the statistics that people have tossed around, I'd like to see a bit more evidence around them. I think the issue about the comment about you can't catch fatness, yes, that's fine and funny, but actually I support Jane's idea, and I think there's enough research to show that our weight is often reflected in the company that we keep. So there is an issue around that. I think one of the issues that hasn't come up particularly, except I thought the lady ahead of me was about to say something about it, is about affordability of healthy food. I think we're in real danger of trivialising the impact of type 2 diabetes. This is not just some little disease that you get, you take your insulin or your tablets and you're okay. These are diseases that have a horrendous effect and can lead to a very, very prolonged and painful death.
I think part of the problem is the fact that we tend to compare one end of the spectrum to the other. When you see someone who is obese, like it was pointed out, it is, especially in the TV, it's someone who is morbidly obese. It's not someone who is, just came into that category. It's always the extreme end. And then when you see people that are healthy, you always see people that are toned with the six-pack, they go to the gym 5 times a week. You don't see what I'd say are sort of normal people represented in the media, and the idea that you can, be healthy and have a BMI, but that is within a healthy range, but you won't have like this, perfect idealistic body shape per se. You'll just, you just won't necessarily be overweight. And I also think we forget that you can be fat and fit, but you can also be, skinny and be extremely unhealthy.
Thank you. I'm still reeling from the woman here with the idea that they'll ban large bottles of wine. Jane, there was a question direct to you, so would you like to start us off?
Yes, I'd like to defend the whole of my discipline in 30 seconds, if that's all right. I guess what I was trying to say is that we eat for so many complicated reasons, not to do with our genetics and not to do with our biology, and we eat because of the ways in which we've learnt to create meanings and relationships with food right from the very, very beginning. And my anecdotal example is an example which is backed up by quite a lot of quite good evidence about how children and adults learn about the meaning of food from their friends, from their parents, from the ways it's presented to them. If you say to children, eat your vegetables and you can have pudding, then we know that they go away preferring pudding to vegetables. If you say you have been good, you can have a biscuit, we know that they then go away using biscuits as a treat. Because food is created, and the meaning of food and our relationship with food is created from the very moment that we come out. That doesn't mean to say that everyone then trajects into a future of having either eating disorders or obesity, but it does mean that people have a relationship with food which is not really about hunger. And that's the problem which affects everybody, that food is never really about hunger and we don't stop eating when we're full. And because of that, we're then much more prone to develop an eating-related problem. And that's what psychology is.
Just 2 little things that I think are interesting. The first is the nub of the debate about public policy versus private personal responsibility, and at what point is it acceptable for the state to butt their nose into the private decisions of individuals. And clearly there is, it's a question of judgment, and for the judgment that I think is the right one on this area is, first of all, within schools, we can, through educating carefully, improve the lives of the children who go through those schools. And what else is a school for if it not to give children enjoyable, fulfilled lives, or try and help that? And secondly, I do think the cost to the NHS is so large that if we can come up with an effective intervention, it is not necessarily a bad thing to do. In fact, it'd be a good thing to do. Which brings me on to the second point, which was very eloquently put by the woman in the glasses at the back, which is that it's a minefield, this area, and there are all sorts of potentially disastrous, unintended reactions to any action. So, for example, this terrible kind of diet club in a class at your school, I mean, it sounds horrific. It can get very preachy. It can lead to food being medicalised, which is something I'm very worried about. Food should be something about enjoyment. But I don't think the fact that something can be done wrong or lead to negative outcomes, if done wrong, means that you shouldn't try and do it. So I think you have to separate those two things. First of all, you have to say, is it a big enough problem to warrant some kind of state action? I believe yes. Are there potential negative problems from treatments that from approaches you might take? Yes, but that doesn't mean you shouldn't try and do something about it.
Angelica, if there's anything you'd like to come back on?
There are kind of several things. I mean, one thing which I find quite interesting is that the discussion seems to move very often between these two extremes. Can we have long, thin, miserable lives or short, fat lives with chocolate cakes? I think there is something quite interesting that every time when we talk about food and when we talk about eating, we seem to think about extremes. We are either underweight or we are overweight. We are either happy or we are unhappy. And again, I think it's much more complex. Now, but one question I would ask, if all of you had the choice between some fairy godmother comes in, size 10 one, of course, and asks you, you can have a choice for your life. You can be a normal weight, yeah, whatever normal means here, but neither underweight nor overweight, or you can be fat. And this decision will be made. You don't have to do anything for it, but you make the choice. How many of us would say, I'll be fat? Because it isn't like that. It isn't this easy, as the lady said before. We all are in charge of our choices. We live in a society where many choices are made for us. For example, the choice about the large drinks. This is a choice made by multinational companies who want to make a lot of money out of our misery and out of our fatness. And that is something which we also should think about. Any kind of interference, when we think about state interference, we always seem to think about the nanny state. Well, do you know what? Nannies are not that bad sometimes. And sometimes, actually, I'm quite happy if somebody tells me, somebody with more expertise, what might be a good thing or a bad thing to do. That is not the case in every situation, but it seems to me very much a British and even more an American problem, where the state is always, in a way, the baddie in this occasion. Where I think if you come from other countries, if you go, for example, to Scandinavia or other countries where the state actually has quite a strong saying in health issues, there are a lot of people who are neither fat nor thin and nor completely happy and nor completely unhappy, but find a way of living. So maybe we should also try and think about solutions that are outside of our own cultural circle and think about outside the box.
I mean, I'll just deal specifically with this one question for now about the figures and whether it's I'm trivialising things. The figures about the plateauing of obesity rates come from the Health Survey for England, from the Centres for Disease Control in the United States, and from research that's done comparative studies on obesity rates in developed countries. I mean, obesity rates are going up in countries that don't, at the moment, have a particular obesity problem, but in the countries that have had it for a while, it seems to be plateauing. In terms of the social situation, it's true that social factors do play a part. So it's no accident that just about the fattest group in society are the 20% richest men, and just about the skinniest section of society are the 20% richest women. because of the different social pressures that are going on there. So, yeah, I mean, obviously, but you know, whether those 20% of at the top of society among women are happy, constantly monitoring what they're eating so that to make sure that they stay slim and constantly always being a bit hungry, I wouldn't say that that's a particularly happy situation to be in. In terms of type 2 diabetes, yes, there is a problem with type 2 diabetes if it's uncontrolled, if it's not detected, and there's some particular work. I mean, I went to an event a few years ago at the Dana Centre, the Science Museum, specifically looking at ethnic minorities, where there is a real problem with undetected type 2 diabetes. And I think the more specific work needs to be done on improving that side of things. But making a sweeping claim about the idea that we're all going to get type 2 diabetes because we're getting fat is very, very unhelpful. For example, it means that people will go, I'm not fat, therefore I won't have type 2 diabetes. And that's a very bad assumption to make.
Thank you. Okay, so there were a couple of hands at the back. So you, yeah.
To take something that I think Henry said in estimating the cost to the NHS. Firstly, we should be kind of sceptical of those figures. Those types of studies tend to be cost of rather than a quite a complex thing calculating benefits. But let's say it's true. Now, that's a social cost. That is a negative externality. This is a rather simplistic solution to it, but if it were possible, all things being equal, you increase taxation on foods related that make people obese, we cover the extra cost of the NHS, may even be running into a surplus. If that was the case, that there was no negative externality to the rest of us, would you and would we still be talking about obesity and people's weight? I think we would. And why is that? Clearly, the cost to the NHS is not a significant reason as to why we're discussing this. And I'm suspicious of the maybe real reasons underlying why we're talking about this. Because taxation can clearly cover the externality, and therefore it's none of my business. It's not harming me if people are obese.
There seem to be two slightly different questions going on here. One which is, do we have, is obesity a big social problem? And the other one is, if it is, what do we do about it? And I was thinking, well, perhaps we could try and separate them. But in reality, of course, it's very difficult to separate them because the evidence for obesity being a big, widespread problem in society and the outcomes of it is not neutral. I mean, Rob was citing the fact that the people who are, whose health is genuinely impacted by their weight are the people with a BMI of over 40, and they are 2 or 3% of society, and they have consistently been 2 or 3% for some time. And it's the people who are a bit overweight who are increasing as a proportion of society, and there's some evidence that is better for you than being underweight. So if you wanted to try and look at evidence objectively, it's actually quite hard to separate out those kind of things from the public health messages, and it makes you realise that when people say, we want the evidence and then we want to make policy, it's actually really difficult because the evidence is usually very tied up with wanting to change people's behaviour. And if you want to change people's behaviour and make them worry about their weight and their kids' weight and make them, be careful what they put in their kids' lunch boxes, then you have to convince them that this is a big problem and it's a big problem for the future and that they're being irresponsible parents if they don't pay attention to it. And in order to do that, you say, some massive percentage of society is obese, whereas actually, the big problem is really a very small group of people. But then it becomes very difficult to actually sit and have a cool, sensible, grown-up discussion of how big the problem is. And I think this is actually something that's a widespread problem. We talk about evidence-based policy, is that the evidence is often not something that is, let's find out the facts and use that to inform things. It's often something that is wheeled out as a way of trying to change all of our behaviour and not treating us like responsible adults, and not treat us like people who can decide whether to buy a large soda or a small soda or whatever. So I was trying to make this clearer, and I feel I've muddied it some more. Sorry.
Do you not think obesity has a correlation to where you live? I mean, I live in Hackney, and the amount of chicken and chip shops and kebab shops within a mile of my school are so many, literally over 10 plus. So people obviously know what they should and shouldn't eat, but it depends if they have access to what they should and shouldn't eat. I mean, surely if you're coming out of school and you're hungry and it's so cheap and so widely available to eat junk food, then shouldn't we focus on making people eat healthy food? And obviously, you got like your Jamie Olivers and whatnot, but make it more local in a sense.
I think we've overcomplicated the message of eating healthily and being the right size, because we've got people who are normal size thinking that they're too fat or too thin, and we've just got everybody worried about being something. And then in schools, we're giving the impression that you've got to eat right, eat right, eat right, eat right. What happened to exercise? Yeah, we've got free swimming membership, but there's no real, oh, we should use it. And there's no real, what do you want? What exercise clubs would you like? What exercise would you want? There's none of that. And I think if we actually ask children what they would like to do for exercise and things like that, they'll enjoy it more and there'll be less of a problem of what you eat.
Thank you. There is now 1 minute each to sum up and answer any questions that you would like. So we'll go in the same order. Jane.
Okay, I guess from all of that discussion, I suppose my conclusion is really about the relationship between individual choice and the role of the nanny state. And that ideally, we would give autonomy and choice back to the individual, and they would make healthy choices, and they would eat well, and they would look after themselves in all sorts of ways, in the same way that they would wear seatbelts and they would not smoke. However, behaviour change is really, really difficult to do, and people don't always do what is good for them, and sometimes they do need some kinds of help. And whether that's banning smoking, having seatbelt laws, or just simply making fast food outlets not clustered around schools is the way forward. So some nanny state, I think, is a good thing.
I think it's a difficult and complicated problem, and it requires quite a complicated solution. There's a man called Pekka Paska, who is a Finnish health expert, who, starting in North Karelian and then rolling out across the whole of Finland, use all sorts of interventions to improve the health of the country, from lighting ski paths so people could use in the winter, to giving people shoes, older people shoes with bottoms so they could walk, to reducing fat in sausages and salt in sausages, etc. Since that time, in the late 70s, the average life expectancy of a Finnish male has gone up by 7 years, which is much more than in the rest of Europe. And heart disease, they've gone from being the number one country in the world for heart disease to being down in the bottom quartile. So it is possible to do something. It is worth doing something, but it isn't going to be easy.
Thank you. And Angela.
Okay. I think what the discussion showed today is, and what the panel, I think, said as well, is that it is a very complex problem. There is no easy solution, and there are no easy reasons. But I think there's one thing which I certainly would like to think about, and this is that any kind of weight issues, and that includes underweight and other eating disorders as well, we live in a society, I think, where treating these eating disorders, obesity, anorexia, will cost society money, will cost the NHS, will cost the taxpayer. At the same time, we live in a society, in a market-driven capitalist society, that makes a lot of money by selling diets, by selling calorific food to people. And I think that is where the complexity starts, and this is what makes it very difficult, and also very much a political issue. And the idea of private choice, unfortunately, I think goes way down here, and we are much more, in a way, controlled by forces already, and the illusion that we are in control of our lives, something we should think about. Thank you.
First of all, if I have a take-home message, it is, don't snatch a sandwich at 12 o'clock and then expect to go through an obesity discussion without your stomach rumbling. I've been putting Angelica off. Secondly, the fat tax thing. Well, what if there was a 20% tax on unhealthy food, right? So crisps, biscuits, whatever, would cost 20% more than, say, raw ingredients like meat, vegetables, and things like that. Well, that is already the case in the UK, because all those good things are VAT 0 rated, and all the naughty stuff is got 20% VAT on it. I did a back of a fag packet discussion, calculation, and I reckon that was about £4 billion a year in VAT. There's no official figures, unfortunately, on that, but it's certainly in the billions of pounds of VAT because of fat as well. I think my general attitude to these things is that the state intervention is not particularly helpful in these things. It actually tends to make things worse, or it acts in a very illiberal way. I think that the problem is generally overstated. Let's look at the specific areas where there is a genuine medical problem. Very, very fat people, people who have got type 2 diabetes. Let's look at those things and see how we can solve them by making a generalised claim that we are all at risk from obesity and that we are all at risk, therefore, from a number of chronic diseases related to obesity. It's just not helpful, and it is just fear-mongering.
Thank you. Somebody tweeted the other day that it's the job of the Battle of Ideas to raise more questions than it answers, and I think that's certainly the case with this session today, and the whole discussion of obesity and food, and particularly with children, I think is not going to be one that's going to go away. So should we thank our panel for some great contributions to that debate?